Welcome to the Triage Method podcast Q&A segment with me, Gary McGowan, and my co-host, Patrick Farrell. So as you guys know from the last couple of weeks, these are the Thursday episodes that explore a quick question that we have been asked from someone on social media, someone in our Facebook group, or one of our clients. Obviously, our coaching clients do get priority, and that is the case again this week. So one of my clients...
should also mention just with that, like obviously when these questions are asked, we actually answer our coaching clients like
Yes.
like it's not just like, yeah, hold on, I'm not going to answer that.
Wait a couple of
Answer
weeks.
it on the podcast. Yeah, no, like obviously they get the answer straight away. But as we discussed the last time, there are questions that get asked that are really beneficial questions for a wider population, a wider audience, whatever you want to say. So obviously, if we think they're good enough of a question to be asked, or rather answered, that will help a lot of people, we obviously answer them. But anyway, go on.
Yeah, so this question came in from one of my clients who is a personal trainer himself, and he was having his questions about one of his clients. So he asked, I have a question regarding a new client, which I wondered you could give some insight or advice. They have scoliosis and have struggled with back pain all their life. But bar the obvious ones, is there any considerations you would take into account when it comes to training and programming? So for those of you who aren't aware, scoliosis is basically an S-shaped curve of the spine, pretty much. So a curvature of the spine. And I don't mean the curvature that you might see looking from the side. So, if you were looking side on at someone looking towards the lateral or outside aspect of their arm, you might see that they have a real arched back, the type of thing you might see during a bench press or something like that. So there's that curvature that you see side on, and that's generally, your lower dotting and your kyphotic curves, and there's a normal curvature to the spine there. However, when we look kind of from posterior to anterior, from back to front, that's when we're going to spot something like scoliosis, so some sort of curvature in the spine. And these can be normal. A lot of scoliosis presentation, like a lot of you listening to this might even have some degree of scoliosis that might be very minor, but some scoliosis maybe can be more significant and require surgical intervention. However, they tend to be very severe, and it's generally the result of compromising respiratory function or something like that. So if you happen to look in the mirror and you're like, oh, I see my spine isn't perfectly straight, you needn't necessarily stress out about that. You don't need to go and get surgery and have it corrected or go to a chiropractor or anything like that. So like that's basically just like, that's what scoliosis is, full stop. What we really want to focus on is the implications that something like that might have for programming. Okay, so in this case, I wouldn't really be thinking about sweating specific programming decisions very much. And the reason for that is because if you think about the path that this person has taken, probably throughout, I don't know, it depends what age they are, but maybe throughout their the last 10 or 15 years when they've been trying to make activity decisions for themselves, it's very likely that the medical professionals and healthcare professionals that they've been consulting with up until now have been adopting a very conservative and overprotective approach towards activity. That tends to be the common experience of people like this. So there was a case report published in the British Journal of Sports Medicine that I shared in our Facebook group just about 2 weeks ago. And it was a story of a powerlifter. So he's now a powerlifter who previously was a scoliosis, he obviously still has a scoliosis, but previously had been given all of that advice, about not lifting, about minding your back, about, X being dangerous and Y being contraindicated. All that typical advice that someone with back pain in general and someone with scoliosis especially is going to receive. And that was a really interesting paper from a kind of a patient's perspective, the actual person's perspective, giving insight into how these narratives of being told that, basically you're weak, you can't do these things, you're fragile, how that actually impacts someone's life, because that essentially is what happens. Is these people, when they consult with medical professionals or healthcare professionals who maybe are not very understanding of the benefits of exercise in these cases, maybe don't understand the psychosocial factors that might impact someone's pain experience, then they're likely to be, you know, very conservative and think, all right, I need to make sure we don't damage the back. Okay. And then down the line, what we end up with is things like fear avoidance and, you know, kinesiophobia, people being less active, people, you know, catastrophizing about their situation, being afraid to engage in certain tasks, potentially being limited socially. You know, if they can't go play five-a-side with the lads, or they can't go on nights out, you know, with their girlfriends because they're afraid of getting bumped around. Like that's a very real report that happens from some people. So these are the types of experiences that people end up having. So to get to the point of that, the point of all of that, of bringing all of that up, is to say that this person has probably been given all of that don't do this advice already. So if you are the, you know, fitness professional that is consulting with individual, I would be far more focused at this point on finding what they can do and trying to move that forward over time. Okay. So like what that might look like is, you know, saying to that person that, okay, I understand, you know, you've got back pain, you've struggled with this for a long time. I empathize with that, totally appreciate your situation. But I think it would be really good to, you know, start with things that you can do. We'll see what you can do today in our first session, and then maybe we can build that up over time. So that could be as simple as starting with something like a kettlebell deadlift or a goblet squat to a bench, seeing how the person gets on with that. And, you know, once they've accomplished a couple of sets and they see that they can do it, they think to themselves, you know, that wasn't too bad, you know, and then you start to just slowly nudge things forward over time. Because there's two approaches that can be somewhat harmful unintentionally in cases like this. One is the personal trainer who's maybe too conservative and starts to focus on trying to fix things. So for example, if your first program, the client comes in and all of your emphasis is on, right, we need to fix this back, we need to make sure that all these individual muscles are strong, and we need to fix the curvature, and we need to achieve all these prerequisites before you can even attempt to do a squat movement, that's likely to reinforce those beliefs in that person that, all right, I actually am kind of fragile, I need to be careful. Okay, there might be some harmful effects there. That's not to say your intentions aren't good. Similarly, on the other end of the spectrum, like if you walk in and the coach is like, all right, we're doing 5x5 deadlifts at RP 9 today, you know, and then we're going to test your 1RM squat after that. That mightn't be the best idea either, especially for someone who does not have any tolerance to training. They're quite fearful of these movements. You don't want to totally overshoot it. So that's probably one of the misconceptions sometimes when people maybe listen to us talking about pain or, you know, exercising in the presence of pain. They think that because we're saying, all right, you know, doing nothing is really bad, that it's just like, oh yeah, just do whatever. Like, and that's not the case. It's about graded introduction, graded exposure, building up tolerance, and building up the person's sense of self-efficacy that they can actually do these things. So for me, they are the biggest considerations that I would be thinking of. And like, that's not to say that you know, anything goes either. Like what I really want to emphasize is that you can still decide that some things are better than others. For example, if you attempt on day one a barbell deadlift, and you're going in with this attitude that, oh, I need to get this person to do a barbell deadlift because that's going to give them confidence and self-efficacy, like that's good. But you need to have a plan B. You need to be able to say, you know, if the person's like, oh, that just feels really bad for me, you know, it's really uncomfortable in my back, it just feels too heavy for the moment, the movement's awkward, you know, being able to just say to the person that, oh yeah, that's actually no problem. Let's try with this kettlebell. Most people find that easier. Generally, when I'm coaching people to do the deadlift, we tend to start with a kettlebell. I was just seeing how you got on. Then the person is like, okay, you know what, that's cool. You know, I now know that other people have this experience. I know that there's other options. I don't have feel like if I don't accomplish the one specific exercise the person cares about, that I'm failing. You know, because you don't want your client to feel like they are failing you. You know, you never want that to be the case, within reason. So yeah, they will be the majority of my considerations. I alluded to in the answer I actually gave to my client. You can get more specific. Like, for example, if someone has quite a significant scoliosis, one of the things that you might think about is, how does that actually change the muscle attachments that I'm dealing with? For example, the lats, the latissimus dorsi is one of the most obvious muscles that would be affected because it has such a broad span origin, you know, running from the vertebrae to the thoracolumbar fascia all the way down to the ilium, to the hip bones. if you think about the implications of that, if someone has a scoliosis, if it's very significant, then you've got the origin being dragged way more to one side, on one side, and then the other implication on the other side, basically it being much closer to the insertion. So that's not necessarily to say that you need to try and fix that. Not at all. Like, this is the way the person has developed. But what you might say is that, all right, these exercises are likely to feel a bit different for you between sides. So you could potentially think of, how does this impact specific exercise selection? For example, they might feel that when they do a straight dumbbell row with the arm moving in a straight path in front of them, that one side feels great, but the other side, they're just not really getting all that much. So you could play around with the angle that you're pulling at. That might change the way that lat wraps around the rib cage, and change that person's experience. But they're the sort of things that you establish through tinkering. It's useful to have the rationale, the understanding of the anatomy and the mechanics, etc. But you can tinker those things. You can say that, all right, this person is uncomfortable with these unilateral exercises. Maybe I could change the angle. Maybe I could change the equipment I use, etc. And show the person that you're not just trying to fit them into your box, that you're trying to do some sort of customization. So they would be most of my considerations, off the top of my head. Do you think there's anything else
But
that
no,
you'd
so
consider or that I left out?
basically what you're saying is don't go into it with a preemptive fear around movements, because I think, like, especially like coming, like, I obviously am a physiotherapist, so I don't have the knowledge base that you have around specific issues now, but obviously I've trained a lot of people, so I'm like, okay, I understand that. But if someone came to me and they had an issue, say again scoliosis, that's actually, in my mind, I'm like, that's not really a huge issue unless they are literally like bent sideways. I'm like, yeah, like everyone has a little bit of deviation here. That's you're fine, so maybe that wouldn't be an area where I'd be like fearful. But I do understand that, as a personal trainer, when you're training individuals, they come to you and they're like, oh, I have this tear on this muscle, or I did something to this joint, or did whatever in the past. Like, you can come into that and kind of go, like, I'm kind of scared of my knowledge on this, but I'm also scared on, like, hey, like, what should I do around this? Like, you don't have the experience or the knowledge base to be able to go into that situation like with 100% confidence. So that's why, like, obviously you ask other individuals that are in your field that, maybe deal with this stuff more frequently. But I can really empathize with, like, wanting to effectively have a program or an exercise selection cheat sheet where I'm like, these are the exercises that I do, and these are the safe ones, But that, in my mind, I'm like, that actually hinders your client's progress, because you go into that with a fearful mindset. And like you said, like, you're not going into this with like big dick like mindset where you're like, oh yeah, nothing fucking matters. Do fucking get in under that squat bar there. It's all grand. Like, don't even worry about it. Like, obviously that's not the mindset we want to have either. It is that kind of, we'll call it, like you said, like that graded exposure mindset, where it's like, okay, there's some movements that you may have a different experience of, or some movements that you potentially aren't ready to do right now, like, you don't have the motor control right now. But that's the same with everyone who comes to the gym. Like, that should be your go-to with everyone that comes to the gym. It's like, there's no, like, all the movements, they're literally made up, so you pick the tool that's most appropriate to the job. So if an individual comes to you and says, I have scoliosis, that doesn't necessarily change how you view your programming for that individual. Because, like, well, what we emphasize is, you should have a lot of tools that you understand what you're trying to achieve, and you just choose the right one for that person. And it should be a kind of graded exposure. Like, it could be something as simple as like, oh, you have someone coming to you and they're like, I previously injured my back, so I'm a little bit fearful around that. And you have some sort of protocol to deal with that. Maybe it is like, say, with leg training or something. You're like, okay, I'm just going to start you off on a leg press here, or a hack squat, or some movement that they feel more confident that their back isn't going to be, oh, it's going to blow out my discs, they're going to blow out my spine, they're going to be on the wall behind me, they're not fearful around that. And then you build that like self-efficacy where you're like, okay, cool, like we're all good with that squat movement, now can we see if we can do it in a kind of more, we'll call it free living movement pattern, where we're doing something that you don't have support behind your back. It's like, okay, like you said, like a goblet squat or something. You know, it's like, okay, can we see how that progresses? You're like, okay, see, look, you're pretty good at that. You're getting stronger at that. Let's see if we can progress to, you know, a barbell squat or whatever. And again, that doesn't mean that everyone has to progress to that level or to that exercise, but you effectively are just trying to build confidence in that individual's ability to move, you know? And like you might notice that there are, we'll call them movement discrepancies, you know, like they have scoliosis. In this example, like you might notice that they do like laterally shift or something in the squat, you know, but that doesn't necessarily, like, while you might be like, oh Jesus, that's a big issue. Like, I don't want to see like that pelvis like shift a little bit. Like, you have to remember two things with that, right? First of all, like humans are really adaptive in terms of like they'll find a movement pattern that suits their body, you know, and that, like, again, like you see people that have like, you know, really serious like medical issues or like they've been in a car crash or something, like they'll effectively teach themselves to walk again using the abilities that they have currently, you know, and it may not look like walking as a quote unquote normal person does, but they're still able to get the job done. So that's, in my mind, I'm like, that's not a huge issue. Now, you may want to address something like that because it could just be a technique issue. They're like, oh, I'm really fearful of my right side, so I don't want to put too much pressure there, and I'm just shift all my weight to my left side or whatever. Like that's fair enough. Like, you do have to give some coaching, obviously. Again, we're not saying that like, oh yeah, it doesn't fucking matter, nothing matters, like do whatever, you know. Like, obviously you do need to put some emphasis on, we'll call it the correct technique or whatever you want to call it, you know. But notice or realize that there are going to be deviations from what you think as a trainer is like perfect technique or good technique or whatever. Like they're going to find a movement pattern that suits them. But also, again, like realizing that there are no necessary exercises. So if you feel that you don't feel confident that they're going to be safe in loading that like progressively over time, you know, like there's a huge deviation, like lateral shift in their hips, you know, and you're like, look, I don't feel confident. Even if you're like, I just don't, you don't think it's going to cause an issue or whatever, you're just kind of thinking like, I don't like to see that. You know, you can move them onto something else that you don't see that shift. You can be like, okay, cool. I actually feel, you personally as a trainer feel confident in giving them confidence in that movement, because I think that's also not addressed quite often. Like we talk about, like, say, empowering the client, but like you kind of have to be empowered yourself to be able to empower the client. Like if you look at them squat every single time and you're like, like you feel like you get that fear, like that's like, there's no way that you can just hide that completely from the client in front of you, or even if it is, you know, like in the virtual sphere, you know, you're training them online or whatever. It's like there's no real way that you can hide that fear from them. So like in my mind, I'm like, okay, cool. If their goal is to squat and I'm still getting that fear, you know, maybe this relationship isn't the best one. Like this coaching relationship isn't the best one. Maybe I'm not the best coach for you. I need someone that's actually more adept at this. Or it could be the case of you going, look, I don't feel confident in you progressing this. You maybe don't say it like that because, again, you don't want to build a negative relationship or fear around movements. But you're like, okay, can we switch to this exercise, one that you do feel confident in actually progressing them on? Well, how would you feel about that, Gary?
Yeah, I think that's fair. Like, I do think that sometimes, like, it is our own inherent biases that actually limit our clients, because if you, as you alluded to, if you are that type of person that, like, when you're looking at the person lift, that you're just like, oh shit, is this dangerous? I don't know. Like, if you genuinely don't know, and your initial instinct is that this is dangerous, then that could potentially then brush off on your client by you making those decisions, or you showing that you are, you know, scared shitless every time they lift, you know. So you don't want to reinforce that. And I guess part of that is somewhat like exploring yourself, you know, the rates of injury in weight training, for example, or even, you know, having a think about what am I actually worried about when it comes to this exercise? Is there a significant risk here? And then weighing up the risk to reward ratio, I guess, of someone doing weight training in general. Because generally when you start to weigh up those things, you're like, actually the risk associated with weight training tends to be relatively low. You know, it's relatively low. And when you look at like exercise deviations that someone might present with, like, for example, a little bit of lateral shift on the squat, when you actually ask yourself, like, what am I really worried about here? It's like, like worst thing that can happen is that the person's probably going to be, loaded a bit more on one side. And maybe it could be the case that that person has a little bit more soreness in one hip or one side of the back after the workout. It's like, yeah, it's not that much of a big deal. You'll be fine by the time you go to your next workout. Point being, not that you don't try to address those things at all, but that the risk associated with that is not necessarily that high that you need to be like, oh no, we shouldn't do that. We need to change to this. So I think just being optimistic about what people are capable of adapting to, and optimistic of what people can actually attempt. I think that's really helpful when dealing with people who are, in pain or have some of these musculoskeletal abnormalities, so to speak. And that's really how you're going to be able to help people. So the part of that does come with addressing our own biases, addressing, why do I think this? Why have I come to this thinking that no one should squat? Like, for example, like I was speaking to one of my clients a few weeks ago who had, he'd received some education from some other educators and stuff. And one of the things that the impressions that he had was that you need to make sure that someone has loads of different prerequisites before they attempt to do a squat. So, for example, doing things like loads of unilateral work first, having like balance between the hips, and doing, core work. And I'm not sure what else was on the list. Like that's irrelevant. And I respect the educators, but the point being that, if you have all of these prerequisites or these ideas that someone could only do this exercise when they have achieved this, you have to ask yourself why. Very simply, like, why is that the case? Why would someone need to have to go through all these hoops before they could do an exercise with simply light weight, and often it's because they perceive there to be some sort of risk. And then when you actually ask yourself, all right, what is that risk, and how do I know that that risk is present? You'll often find that there's very empty answers, because even the research on like weight training and injury risk, it's not like a big body of evidence, and the evidence that is there would suggest that weight training is like relatively safe compared to other sports. And then when you think of the way that other people approach other sports, you very rarely hear someone saying that they're not going to go out and play 7-a-side with the lads because they don't have balance between their hips, or they haven't done enough unilateral work or something like that. So it is interesting to ask, why do we treat those activities different to weight training, when like those activities have a higher rate of injury, and the fact that the injuries can potentially be more serious, so for fracturing your femur, not good, potentially can happen in soccer, never going to happen in weight training unless you do something ridiculous. So yeah, that's I guess everything we had to add.
Just on that as well, like this, firstly on the prerequisite thing, like I always think, I'm like, well, like I can get behind this to an extent, right? If there is like that's basically, they're saying like this is a graded exposure. They're giving you a method of graded exposure. It's like, yeah, if you're able to do a split squat here, if you're able to do a Bulgarian split squat, it's like, yeah, you have, the perfect symmetry between your legs or whatever, even though again, like it's a bit of a lie that there is perfect symmetry or whatever, but you're like, yeah, you have all these prerequisites. Like in my mind, I'm like what, like, why are the stop points arbitrary? You know what I mean? Like, it's like, okay, so we'll take the squat or whatever as an exercise. You go through like, okay, you should be able to do, we'll just say you should be able to do a leg press. You should be able to do, a goblet squat. You should be able to do like split squats, like whatever prerequisites you want to call them. Like, again, like I would just call it a graded exposure or whatever, but like you name all these prerequisites to get you to be able to back squat, right? Like, why is that stop? Why do we stop there? Like, why aren't we keep going? Like, why don't we go like, oh, you should be able to do this to do fucking power cleans, and then you should be able to snatch. You should be able to, like, you can just keep increasing the complexity of the exercise. It's like you've just arbitrarily chosen an endpoint, and you've then arbitrarily chosen different exercises to be prerequisites to that endpoint, right? And like the rationale behind it may be like not the rationale, the actual application behind it may be smart in terms of, it's like, okay, you should be able to control your body in relative to the stuff around you, And, this is the way we can go about doing this. If you're able to do a split squat, it's like, yeah, cool. Like, let's see if we can get you able to do a squat now. It's like, that's in my mind, I'm like, that's cool. It's just a tool. It's just a method, but the rationale is often like very arbitrary, like you said. I always look at it, I'm like, who are we setting these standards off? Because if we set it off, say, for example, me, like I could, if I'm the person that sets the standards, or first of all, we've already discussed on the podcast that I have hugely unrealistic standards for strength. Like, just they're not in touch with reality. Okay, so that's the first thing. But also, like, do we set, like, if I'm like, okay, well, we want to have an open, mobile pelvis. Like, my open mobile pelvis, like, I can do the front splits and the side splits. So do I say that that's the prerequisite to being able to squat now? Like, you have to be able to do a box splits before you're able to squat. Like, it's just a prerequisite. You're not allowed to get under a loaded bar unless you're able to do that. You don't have mobile hips, bro. It's like, you're not allowed, So, like, in my mind, I'm like, these prerequisites, I'm like, they're just arbitrary. But again, like, exercise itself is arbitrary. Like, the actual tools are somewhat irrelevant. Like, obviously there are better tools for the job. And as I said, like, with the prerequisites, it's like this, if you use this appropriately, it's probably a good method for getting someone in to be able to do a squat or whatever movement it is, Like, it's like, oh, cool. Like, yeah, we're going to make sure that your core is actually strong enough to be able to do this. Like, I can get behind all that. Like, I'm like, cool. That's, again, it's just, you're just giving them exercise to do that gets them to a point where they feel confident squatting under a bar. But I also don't think you should be spending like 3 years of training with an individual not actually achieve their end goal because you've been like, oh, well, we didn't actually, I know you wanted to be a power lifter, but we weren't able to get the perfect ratio of our split squats here. So I never got you under a bar. You actually never learned to squat. You've effectively, not used those 3 years to learn your sport, And like you said, it's like this, like the other sports are not doing this, It's like they're probably more dangerous to do, and nobody seems to bat an eyelid about those, So there's that. Do you have anything to add to that? Because I have another, essentially a question, but it's more of a thought process. Huh?
No, you can ask your question.
Right. So with all that in mind, like this applies to other, we'll call them injuries or issues as well. But I'll give you an example. Like, say again, in the scoliosis, if you might have someone that has like one of their shoulders, like obviously everyone naturally carries one of their shoulders. Well, not everyone, but most people naturally carry one of their shoulders a little bit higher, right? Would you agree?
Mm-hmm. Yeah.
So if you're someone with scoliosis, like that might also be exaggerated, right? So what you could say, if you wanted, that that's a tight trap muscle, right? Not technically correct, but that's, if you were to just visually inspect that person, that's kind of what it looks like. Their trap is a little bit more contracted, looks a little bit tighter. So you're like, yeah, tight trap, right? Now, you might also listen to this podcast and be like, right, well, that's not really something that I need to deal with. Like, yeah, okay, cool. I could maybe do some stretching if I really wanted to, as a kind of, we'll call it a placebo benefit for that individual. Maybe it actually will help them, and overall getting stronger in good movement patterns will help them. But again, we're talking about someone, you're training someone, you're still a little bit unconfident in your movement biases. You're like, oh, I don't know about this. Like, I don't like, should they move like that? You still have that kind of like perfect technique in your mind, which again has its benefits, right? But again, I'm going with this example. Would you be, I'm not going to say fearful, but say, for example, with that, you have someone bench pressing, right? Like their movement ability on that, like they're not going to be able to press that bar in a straight line. Well, I say they're not going to be able, that's probably my bias coming into it, being like, oh, with your trap like that, you're not going to be able to do that perfectly. But we'll just say, for example, they're doing their bench press and one side is way more elevated, like it's more over their shoulder, whereas the other side is more over, we'll say, the nipple line. Every time they get down, both of them are touching the nipple line roughly, and then as they press up, one shoulder kind of elevates up and presses up, right? Now, the individual themselves might experience that as just a difference in how they perform the movement. They might be like, oh, well, I feel this side really in my pec, and I feel this side more in my shoulder, like my front delt, right? Again, this could apply for the lower body, like we were saying, you're squatting. They might be like, well, my left leg, I feel this like a really good connection, but my right leg, not so much. You know, whatever way it presents, whatever exercise, that's cool. Would you, and this again ties into the prerequisite question, you know, especially if they're doing like unilateral movements, would you be more, I don't know, would you think, we'll call them unilateral movements, would you think they're more appropriate? Because I see it in two different ways. For example, that's why I use the bench press. Like, you could argue that the barbell bench press, you know, it causes them to elevate their shoulder and put more pressure on, or more tension on one of their front delts versus the other one, right? You know, so you might notice that in terms of a hypertrophic perspective, like one of their pecs is really well developed and their other opposite side front delt is more developed and that pec isn't as developed. You might notice that visually or whatever, or you might notice nothing, you know. But they might also experience some, we'll call it difference in pain and difference in experience with that. Like, they might notice, okay, cool, get great connection with one side, feel a little bit of a niggle in my shoulder on the other side every time I do that, right? Would you then be like, okay, we're going to use a unilateral movement, which you might think like, okay, that means a one-arm dumbbell press. But in my mind, I'm like, well, as soon as you get rid of the two arms connected, that's a unilateral movement in my mind. So just a regular dumbbell bench press is unilateral in my mind anyway. You know, those two arms are independent, so they can move independently, you know? So would you use something like that, even though the movement discrepancy is going to still likely be there? Or would you be more inclined to move it to something like a chest press where you can get a very fixed range of motion, right? And then how do you also navigate that without inducing fear in the individual? You know, being like, oh, no, okay, you're just not built to bench press with the bar. We're not doing that. You're going to get a shoulder injury from that. Like, obviously, that's not the way to do this, but like, how do you navigate that situation? Because that's going to come into like different exercises, as I said. Like, it could be the squat, it could be whatever. Like, as we address, like, obviously you have to address your movement biases, but what if the client is experience a little bit of, we'll call it, you know, a difference in experience in terms of the muscle sensation, but also the pain sensation that's within that exercise. Like, do you, I'm basically giving you the stuff, but how do you do that, Gary?
Yeah, so I suppose, like, to get back to your actual example, we've got someone who cannot depress one shoulder quite as much for whatever reason. Let's just leave it at that. And then as a result, they've got some asymmetry in their movement during a pressing exercise. Okay, so then you have to ask yourself, all right, what's this person's goal? Because if this person's goal is powerlifting, for example, or it doesn't have to be powerlifting, it might be bench press is the lift I want to improve. Then in that case, you know that, all right, the end point I need to get to is that this person needs to be able to express their strength on the bench press. And then, like, if we leave the pain aside for a second, if we think to ourselves that, all right, this person has an outcome-based goal. It's an outcome-based goal in that, like, they want to achieve a certain lift with very specific parameters, and they want to be able to do X amount of weight. Then we know that it is a performance. It's for a performance outcome. So it's external. It's something that their body is producing, as opposed to an internal adaptation. Obviously, an internal adaptation is part of the process to get there, but the end outcome is that we need to be able to express strength on this exercise with specific parameters. Okay, so with that in mind, there is no movement pattern that is required for you to be able to express that. You just have to be able to achieve the outcome. So if it was just strength and it was just bench press and that was it, wasn't, for whatever reason, they genuinely stress out and say that it needs to be perfectly symmetrical, that's not necessarily the case. Okay, it might be desirable to provide cues to improve performance, but I mean, I would be potentially optimistic in that case in saying that, all right, we've got a little bit of asymmetry. It seems to have been there long term. And if your performance has been improving, and we have no reason to believe that it's not going to continue to improve, then okay, your shoulders are taking loads slightly differently, but the outcome is okay, So I'd be, from a performance perspective, yeah, that's not something I'm going to sweat too much. An extreme example of that is Usain Bolt, fastest man on the planet. Produces 14% more force in one leg versus the other, which I believe is a result of a leg length discrepancy. So you've got to,
all the chads have leg length discrepancies,
yeah.
like myself. What can I say?
So you've got a perfect example of that there, of someone who is, they've got these anatomical quote unquote abnormalities that one might say, oh, that's going to be the limiting factor in your performance. But because it's a performance outcome external to the body and not necessarily just the internal adaptation, you can do just fine. I mean, he's not doing too bad. And that's not to say that if he didn't have that he mightn't be 0.001 second faster. That's not saying that. But what I'm saying is that despite the fact that he's been affected by that, he's still improved pretty well, and he's gotten somewhat fast. So that's kind of just the performance isolated aspect. From a hypertrophy perspective, if this person was saying that, one of my pecs is very clearly larger, I want to compete in bodybuilding, and symmetry is really important to me, and my right pec is just not developing because the shoulder is moving and I feel it all in my shoulder and whatever. In that case, there's very real reason to believe that doing this continuing with this exercise bilaterally in the bench press and moving the way that they are, where they feel that their chest is not the limiting factor on that side, then you definitely have reason to believe that they might have suboptimal hypertrophy outcomes, and you might be able to achieve the symmetry that they desire if you keep on driving on with that exercise. So that's the key difference between performance and hypertrophy outcomes. Hypertrophy is fundamentally about what is going on in, it's not about, all right, how much weight was I able to lift. It's what's actually going on at the level of the muscle fibers within the muscle that you're trying to train. So in that case, you might want different exercises. You might want to find an exercise that you can vary the arm path on, or maybe even a quote unquote unilateral exercise where you are doing, you're still doing a bilateral dumbbell chest press, but you're doing it with the weights being loaded independently on either side. And I mean, I know some people get real afraid of using a different weight between left and right, but if there's a genuine strength difference and you find that you need to take a step back on your weaker side, that's fine. I would have no problem with someone doing a 24 kilo dumbbell and a 26 kilo dumbbell for the dumbbell press if they do, provided not 50 kilos and 20 kilos and falling off the bench. Probably not a great idea. So hypertrophy, it's a different consideration. You might want to say, all right, let's bear on with some of these cable exercises. Let's actually take the wrist out of it. Let's use cuffs. Let's see what way we can potentially train these muscles with the limitations that we have present. So there's different things you can play around with there. Basic take-home point being that the way that you think about these things when it comes to hypertrophy is different to the way you think about them when it comes to performance or strength, which is one aspect of performance in this case. Then when it comes to someone, we're at a point where someone is reporting pain. This is I've got pain in the shoulder. I think it's because I've also got lower muscle mass in the side. Anytime I train it, I feel like my shoulder is my limiting factor. I'm not really able to get my scapula into position. But again, that might be the case where that's a case where you need to potentially modify something. But I would always frame that in a way that, okay, so for whatever reason, we know that the exposures that you've been exposed to up to this point have been pushing you beyond your level of tolerance. So what we need to do is find ways that we can, bring the load back into your level of tolerance of just changing exercises. I would very, very, very rarely frame that in terms of saying, you're just not built for that exercise, we need to ditch it forever. It would be more like, let's give a dumbbell chest press a shot. Let's give this machine a shot. Let's give some cables a shot. Let's see how you get on. And it could be changing repetition ranges. It could be changing range of motion. For example, if the person reports that, yeah, bench press is fine until I come down the last 1 or 2 inches towards my chest. That's really when it starts to become a bit of a problem. Then we might say, all right, let's kind of see what happens if we come down a bit slower. We pause 2 inches off the chest, and then we complete our normal sets and reps with that sort of approach. And if the person's like, yeah, that actually helps to manage my symptoms, then what I would say is that it's not necessary that we're going to do that forever, but let's take the next 4 to 6 weeks. Let's work at this. Let's let the symptoms die down, and then we can reintroduce the bench press to the chest in line with your goals again, with a slightly slower tempo, and we'll keep in these pauses, and then we'll gradually expose. So obviously the specific answers that you give is going to be specific to the person, and you can see how your considerations are going to vary between, right, is this person chasing a performance outcome? Is this person chasing hypertrophy? Is this person chasing an improvement in symptoms? There's different considerations, and I think it is important to think about that. And I guess it just kind of reinforces the idea that there's no simple blanket recommendation here. You can't just have a recipe. It just doesn't really work.
That's cool. I think that, well, I hope that answers the question overall. So to sum it up, again, don't be a fearful trainer, for one. Don't instill fear in the individual. Then make exercise selection changes and program changes as you actually see the client move, and as they actually report on that movement. If they're like, yeah, that feels good, then yeah, again, build confidence in those movements. Again, you may have to make some exercise selection changes. If you're, again, a little bit fearful of those movements yourself, you're like, okay, they're not getting the outcome that we want. Again, like we discussed, there's various considerations depending on the outcome. But if you're like, yeah, we're not moving towards that, thinking of a different exercise that would potentially move them forward, allowing them to try that out, getting feedback, etc. Basically, don't be stuck in your ways, and choose the right tool for the right job given the individual's goals and what they are presenting and how they are progressing with that overall. Yes, do you add anything to that?
No, I think that's pretty solid. And I mean, if you are interested in reading that paper that I mentioned, I do think it's actually insightful for coaches to read, or physios, or anyone involved in healthcare. I think it's useful to get the person's perspective on like what they've been told from healthcare professionals, because it is fairly enlightening. And I think it's always good to hear that someone has come out the other side and been like, yeah, you know what, I actually did take up powerlifting and made my life better through lifting, despite it being probably against what most healthcare professionals would advise. Again, that's not to say that we have an anti-healthcare mindset, not in the
You do,
slightest.
Gary. That's what
Yeah, it's really definitely me.
You want to take it down from within. Also, I think there's another one, you were discussing it in the Facebook group as well before, with coaches, whoever's ability to actually identify injury risk based on, movement pattern discrepancies, or whatever you want to call them, like, valgus knee or whatever. Like, I think that layers on very nicely to this discussion. As I said, like, you might see things and you're like, oh, Jesus, that's going to be an issue, when in reality, like, you're not actually able to identify that. And you discussed that again in the Facebook group as well, because obviously everyone should be in the Facebook group where we discuss these things on the regular. Would you agree, Gary?
Yes. Like, generally, if I find something, or if Patty finds something that we're reading and we're like, yeah, I think people might like that, or they might like the take on points, we'll share it in the group. So I think that's useful, because I mean, man, I don't know about you, but like when you get those emails from those PubMed alerts, like you've got like 100 papers, sometimes you're screening through, you're like, but bullshit, useless. Yeah, people don't care about that. That might be useful. Let's have a look at that, and it saves you a lot of time to just be like, oh yeah, let's see what I might think is important.
Do you not read every single paper that gets sent to you?
Oh yeah, of course. Like,
surely you're not like judging a paper by its title. Like, that'd be like judging a book by its cover.
It helps me judge my potential interests. Like, I mean, when I have my muscle hypertrophy keyword in one of the alerts, and then I get all these rare papers on like the IXDF mutation in a rat model of cardiomyocyte hypertrophy. I'm like, fuck, interesting, but not today.
Save for later.
Yeah.
Yeah, like I have a lot of PubMed alerts for systems chemistry, and I'm like, oh, like that sounds juicy enough, but I'm not going to spend 2 hours reading that, because it's not my field. But I enjoy understanding this stuff. But anyway, where can people find us, Gary?
As we just alluded to, Facebook community is probably the best thing. You know, we get a lot of messages in our Instagram saying, you know, asking us questions or asking for tips on how to modify the program templates. That was one of the questions this week. Things like that, you know, things about the podcast. And I always just respond and say, ask this in the Facebook community. If you're thinking it, other people are thinking it, and it's far more helpful for us to have the answer there so that we can then say, when someone else asks, we just tag them, you know, so it's done. And it's much easier for you and much easier for us so that we can actually Instagram. If I go on the Triage Instagram, I'm generally going on just to make sure we don't have any messages, and I'll click through and I'm just like, okay, yeah, email info@triagemethod.com or go to the Facebook group. So it's far better just to ask there on the Facebook group, because that means that we're sitting down on our laptops, we've gone there deliberately, and then we're going to take the time to actually give an answer as opposed to just, you know, flicking on your phone. You don't want to be doing that. But anyway,
That was
you could
also
email info.
just on that as well, because like we always ask a question when you join the group, like, where did you hear about this? Just because like we want to know what avenues people are actually listening to, etc. And like loads of people said after we were discussing it, like, I actually don't know where it is in relation to this podcast because this is coming out whenever the fuck. But one of the people joining said that they realized after we discussed it on the podcast that the Facebook group is actually a much better method of communication, because you can actually, you know, link stuff. You can actually have a conversation that's kept in a thread format rather than just random comments all over the place that, you know, and they were like, oh yeah, you convinced me that the Facebook group is a much better method of communication than Instagram. And like, I personally, I was like, oh, like surely everyone knows that. But you know, that's only if you're actually already in other Facebook groups or you're interacting on Facebook in that manner. Like if you've just been exposed to, say, fitness through Instagram, like you may not even realize that there are like Facebook groups that are really beneficial to actually helping you achieve your health and fitness goals, because you can actually have a discussion. You can actually talk to like-minded people rather than just like, I don't know, searching hashtag fitness and hopefully following some individuals that, you know, have, excuse me, similar goals to you or whatever. Like if you can actually see in the Facebook group, it's like, oh, there's loads of people, they chat to each other, you know, they're chatting under a thread, you know, you're like, oh, I like that, oh, here's my experience on that, you know, like it's a much better like community, which is obviously what we're trying to build there. But anyway, yes, go on.
But yeah, Instagram is a pretty useless platform for that. I mean, like if someone comments and they're like, hey guys, do you guys have any articles on X? Then we're just like, oh yeah, go to our website.
They're on our website, yeah.
Search for this, you might find it. Because like Instagram, I don't know why. There's obviously a reason, but they still don't have hyperlinks. You can't even paragraph your responses when you're sending a message. So if you send like a comment, it's like one big massive body of text, no links. It's like this makes no sense, and there's no way of going back and searching for it or saving it. So yeah, it's just not a great platform for us anyway. But yeah,
great platform, full stop, unless you're a photographer of some sort.
Yeah, true. Of course, check out our website, triagemethod.com. Articles, resources, and podcast archives. You can find everything that you're looking for pretty much on the website. And you can follow us on Instagram, but you know, as we alluded to, Facebook is definitely a better idea. And of course, join the Triage Method newsletter, and that goes out every Sunday morning, and it includes all of our resources that we've posted across the week. It includes information about any maybe events that we're attending or that we might be running ourselves, and that'll be coming up soon. And then, of course, resources that we've come across from across the internet. So, for example, articles that we've been reading, podcasts that are interesting, videos that might be interesting. I even throw in the odd tweetorial that people do these days. So, you know, we're on the ball.
Yeah, and then obviously if you want to engage in whatever services we offer, there are effectively three options. You have the chance to engage in buying an ebook template. We have a few different ones, you know, depending on how many days you have to train. We also have a beginner ebook. There are quite a few other ebooks we have planned, so keep an eye on that. Obviously, if you're on the newsletter, you'll get, you know, first notification of that. And you can also engage in group coaching, because that's something that like I actually think is really beneficial for a lot of people, and they don't even realize that it's beneficial, because you effectively get the pros of having a template, but also the pros of having, you know, a dedicated community towards your goals. You know, you can send in videos, ask questions, and effectively you get the pros of also having a coach, and you get rid of most of the cons anyway, in terms of the price of having that coach. Like the only con I see towards group coaching, and I say this again as someone who sells group coaching, so I want you to buy it. The only con I see is not having as much accountability as, you know, one-to-one coaching. But that effectively is why there is that price difference. However, there is a way around this if you effectively just ask questions and check in the group every single week, you know, because we're not going to be like, oh, I'm not going to answer that, because that's effectively what I give with, you know, online coaching. If you do check in and you give us an update, ask us questions like our clients would, you'll still get the answer just as like our clients would. So I'm kind of selling that, like, you're basically, if you do that, you get a better option, you know. So group coaching, it's great. And then we do have online coaching available. It is filling up. And again, I know I say that all the time, but as we've discussed before, you know, this is what happens when you have clients finishing up, which is our objective. You know, like I had a client finish up this week, well, actually last week, in relation to this, and I was just on the phone to them, and like I've had them as a client for the last 2+ years, you know. But it's like now they're ready to go out on their own. They've achieved their goals. They have the tools. They have whatever. And it's like, yeah, cool. You're finishing up. Great. We're done. You know? And obviously we have a plan going forward, and being like, okay, well, check in with me in 2 weeks time, 4 weeks time, or whatever, you know, just so we can ensure that that transition to them coaching themselves is effective, you know? But yeah, like if you're interested in online coaching, get involved. All the links to all the stuff is in the description. If you're watching this on YouTube, like, subscribe, share, do all that stuff that enhances the YouTube algorithm. If you're listening to this on the podcast, again, subscribe, because, you know, I think it's like 30% of the people that listen to this aren't subscribed, which is, you know, atrocious, really. You should be subscribed. There, you get it literally brought to your phone every single week, twice a week. Other than that, I have nothing else to say. Gary, do you?
Nope, that's it. It's too easy.
It literally is.